Sorry, I'm in charge of this unit. I am going to check doctor's order for a tracheostomy care for one of my patients. So I have verified the order and I've gathered my materials, supplies. So I am going to see the patient now. Knock, knock. Hello, this is Francis. How are you? My name is Mano Mansare. I have your doctor's order here for a tracheostomy care, in which I am going to change the dressing, replace the inner cannula and the collar, and also check the stomach to see if there is any redness or infection or any skin irritation. I'm going to also clean the skin under the face plate. Is that okay? I'm gonna put my supply somewhere here for now. And so I'm gonna close the door. I'm gonna close the curtain and wash my hand using sanitizer. Can you please state your first and last name and your date of birth for me, please? Okay, can I verify? Just to check and see. Okay, Francis Conte, born 1990. Okay, so I'm gonna raise the bed up to a working comfortable position for me, and then also I would like to put you in a semi-fowler position, 45 degrees. That's okay with you, so that you'll be comfortable. Okay, all right. Okay, so I'm gonna put this railing down so I won't cause any injury on my back. So also, can I check your Autosat, please? And then check your respiration and then breath sounds. Okay. Are you experiencing any pain or any difficulty in breathing? And in case I am doing the procedure and you feel anything like that, please let me know, okay? By alarming, since you cannot talk because of the trick, you just send an alarm by raising your hand up. That okay? All right. Okay. Let me go get the materials prepared, okay? All right, I know your oxygen is on and everything. Okay, so these are clean gloves for now. I want to clean the table where my supply will be to maintain stability. Okay, I'm going to clean my table, making sure all the germs are killed. I have my trash here. I'm going to trash this one. Get my hand wash, sanitizer. Okay, get my supply here to the clean table. Okay, this is my inner cannula, the new one. This is my goggle. This is normal saline. I'm gonna check the normal saline if the date is within okay. It's safe because it is dated and it is within time and date. And this is my extra gloves, which I will use in case of any emergency like contamination, but however I'll have to use it. This is my mask. I'm going to put on my mask, and this is my tray, the tracheostomy care tray. So, and let me put on my mask. Let's check what is inside this tray. What is inside this tray, this care kit, is we have two compartments. We have the tracheostomy brush, we have the dressing, which is the tracheostomy dressing. We have one drip, we have 3 pipe cleaners, we have gauze, sponge 4x4, we have cotton tip applicators 2, we have twin tape, which is the tie, and we have 2 gloves here. So it has also gloves. So now if I'm going to open it, the instruction is still peeled here. So and I'm going to open it all away from me. So now I'm going to take my goggle on in case the patient cough or whatever will meet my face. So now I'm going to open the normal saline, put it here and cover upside down. I'm going to open my inner cannula, ensure sterility, and then okay, I'm going to open from this side away from me. Okay, now I'm going to open the tracheostomy care kit, maintaining sterility. From here. Away. Okay, it has its own gloves again, a drip, as I said, and then I'm going to open the extra gloves. Trust this one. Okay. Okay, my right hand is the dominant hand, and this is non-dominant hand, my left. So I'm going to start with my right hand to fix my gloves, sterile gloves. Away. Okay. Take this one away. Okay, I'm gonna trash this one. Okay, now both arms are sterile. So in this case, what I would do, check the drip. Both arms are sterile. Take the drip. Get my patient. Making sure the signing area is bottom, lies under. I'm gonna drip my patient. Right in the middle, no problem. Okay. Now, I am going to contaminate my left hand and maintain my right hand sterile. So purposefully contaminate my left hand by using this cup container with a normal saline, making sure my palm covers the label so that I won't mess with it, and pour normal saline in this empty container. And making sure it doesn't splash. Take it back, cover it. This is contaminated already. So what I'm gonna do to the patient now, I'm gonna explain to the patient, I'm going to take oxygen away and then put it back after I take the inner cannula out and with the dressing out. Is that okay? All right. So now with this contaminated hand, I'm going to use this hand, get the oxygen away from the inner cannula so that I will take the inner cannula out with the old dressings and then replace the oxygen. Replace it so that the patient will continue to have oxygen. And I'm going to trash everything here now. I'm going to trash everything. Trash. Wash my hands. Sanitize my hands. Okay. Okay, so now I'm going to ask my helper to get me gloves, because this one are sterile. I'm going to use another sterile glove. Helper, can you get me a sterile glove from that table? Sterile glove from that table. No, the sterile glove. Yes, these are sterile gloves. Yes. These are sterile gloves. These are sterile gloves. So now, instead of I use that one, because if I enter there with my naked hand, that means I've contaminated the entire procedure. So therefore, I'm going to use this same one. This is sterile glove. So I'm going to use this sterile glove. right. Okay. Okay. So now I'm going to, this is sterile. I'm going to get my inner cannula to replace it. Sterile inner cannula. Okay. I'm going to purposely still contaminate this left hand. This is sterile. And everything is sterile. So I'm going to replace your inner cannula. Making sure I don't touch any side. And I hear the click sound. Fix well. Gently insert it. I heard the click sound and it's fixed well, so that the patient will not cough it. It's well fixed. So now, still sterile. Everything here is sterile. And if I want, because this is sterile, this is contaminated, now I'm going to clean the faceplate out or bottom and then nap it with dry gauze. So now this is sterile. I'm going to use the applicator, dip it in the normal saline. I'm going to clean only once and then trash. Take this marks, check, then clean at the bottom here. Replace this one, trash. And then take this other one, wet it. Okay, take it out of the way. Okay, clean here and then replace it and then trash. So now I am going to dry it. Okay, I'm going to nap it, dry it. Okay, dry the areas once, replace it, trash. So now I'm going to take the thick dressing, place it under the faceplate. Okay, this one I don't need to use them. Okay. So making sure I don't touch in the middle here to prevent it from contamination. Ensure, okay, from here I just hold the edges, just try to fix the dressing. Okay, now I'll fix it. I only have now the tie to fix the tie. So I've done the sterile area. This oxygen is intact. The patient is having oxygen. So I'm supposed to get a helper and assistance to maintain the face plate in place or the trach in place. But because I don't have any helper to O on that, I can do it by making sure I use the new tie, stabilize the trach, and then remove the old tie. So that is what I'm going to do now. I'm going to use the new tie, which is this, and then I'm going to maintain the trach in place so that the patient will not cough it. Okay. I'm going to take the old tie out on this side and put the new tie first. Put the new tie. Okay. The old tie is still tie. You see tie, and it's still tie, and the new tie is tie also on this side. Then I'm going to put the new tie on here. Put the new tie on, whilst the old tie is still holding. Okay. Okay, so now I've got the new tie on. I've got the new tie on, so it's time to take off the old tie because the new tie is on now. Let me see. Okay. I got the new tie on. This is the old tie. I've taken away the old tie, trash it. Then the new tie is on now. So the next thing I will do is to fit my finger between the tie and the skin and see if it is fitting. Okay, I'm going to fit this one this way. My finger, this one. Okay, you can enter one finger. Okay, and I will ask the patient, are you comfortable? Can you turn your head left and right? Nod. Okay, are you comfortable? All right, so now I'll fix the tie, remove the old tie. When I was doing that, the tie was on. I tied the new tie. After I tied the new tie, I'm making sure I secure the trick, and then I remove the old tie. That is what I trash. So now I'm gonna recheck again to check the AutoSat, and for the last time, good, and then check the restoration, and then check the breath sound. Okay, that's good. Then making sure the patient is comfortable, no pain, no difficulty in breathing, it's normal. And then the next thing I will do, take the drape, trash it. Are you comfortable in this position? I'm going to put the bed down, the railing up. If the patient is comfortable in this position, making sure it's safe, put the cord lights at this whole reach. If you need me, you call me, okay? I'm going to document the procedure. Thank you so much. I'm going to take off my gloves, wash my hands, sanitize my hands, open the door, open the curtain, and take off my gloves, and take off my mask, slash my mask, and then gather all my materials, trash this one, and then take my material, trash everything. Okay, I see you. I will tell the doctor. Okay, goodbye for now.